As a respiratory therapist, you may be tasked with withdrawing an arterial blood gas sample from an indwelling arterial catheter, such as an radial artery catheter that's been placed here. With the arterial line, there may be several lines that are in the patient, so you need to make sure that you're paying attention to which one that you should be drawing off of. Whether or not you're utilizing an open system or a closed system like you see here. You will have a pressure bag. You'll also have a pressure transducer. That transducer has a cable that will be attached to a physiologic monitor, and that's going to take the fluid information from the individual generated in the pressure waveforms that we'll see on our monitor. You've heard terms such like dichrotic notch and so forth. We also want to make sure we pay attention to these three-way stopcocks and you know, turning it off to the patient, turn it off to the monitor, turn it off to atmosphere, so to speak. The reason I want to go over that is because we understand that ECGs monitor electrical activity of the heart, while A lines or arterial lines measure mechanical activity of the heart. So in order for you to have a waveform generated on the monitor, you have to have a palpable pulse in order for that to occur. And that might seem relatively straightforward and simplistic, but the reason I'm covering that is because I had a situation in which I encountered something very similar to what we're seeing on the monitor here. I was working in the neonatal intensive care unit, and I was taping a kid's endotracheal tube, and was called to the next pod over because there was a kid not doing very well. Their SpO2 had gone down into the upper 30s and was dropping. The kid did appear to be fairly mottled, had quite a bit of cyanosis to it, and they were just providing manual ventilation for the individual. The reason they were providing manual ventilation is because they were going off of the NRP guidelines. They were telling me that there's a heart rate of 149 beats per minute, roughly, give or take. You know, it may not have been the exact amount, but nonetheless, it was well over 100 with what they were attending to. So they had continued to go up on the percentage of oxygen through the bag valve mask device to 100%, and still no improvement. I walked up, and the very first question I asked was, had anybody checked for a pulse? They responded with, well, the heart rate is, you know, 140, 150, whatever it was at the time, kind of what you're seeing on the monitor here. And they were just continuing to provide manual ventilations. Well, because of the training I had as a respiratory therapist, because of actually placing arterial lines, I noticed that arterial line waveform, the red line that you see there on the monitor, was flat. And I understand that that could have been a situation which we were looking at PEA, pulseless electrical activity. And in that situation, for however long we had been doing what we were doing with the patient, they were not accurately treating PEA. When they did heed the suggestion to check for a pulse, they found that there was actually no pulse, and that's why the SpO2 was continuing to go down, while the kid's overall skin color continued to look poorly. So case in point here is, the monitors can provide us with a fantastic bit of information. However, don't get caught up in treating the monitor. Make sure that you are treating the patient attached to said monitor. So for instance, with this simulated event, if I'm able to give this individual a blood pressure back, and also important to note that right now, because there is no blood pressure, there is no pulse for this patient. You're going to have to take my word for it because you can't feel that through the monitor. But if I do provide blood pressure back, then now you can see that anytime you have an arterial waveform, it should be coinciding shortly thereafter with the ECG, because ECG is electrical activity, the arterial waveform is mechanical activity, and now we're actually, because we do have a palpable pulse, we're actually able to get that pleth with the SpO2 line as well. Now I know that that's showing 30%. I've not addressed it on the mannequin, but I just wanted to show the importance of being aware of your surroundings, aware of monitoring, and don't forget there's a patient attached to these monitors. So thank you for your time.